I think that the best interest of society is probably a really, really critical one for DeepMind, but it's of course important for them not to think that they can dictate what the best interests of society are.
The big thing for me is in whatever's produced, can we make sure that in terms of digital equity that we don't increase the digital divide between those who have and those who have not.
Clinical applicability and using an evidence-based research basis.
The people first side of things that's starting to come out, so it's having that responsiveness to people's needs and taking them into account along their journey.
I think the most important principles are probably respect, because that I think is an international standard and principle.
Transparency is probably the one of the 7 principles that I think is probably most important. To have someone who's doing something like this and doing the market research and coming up with principles that the public and the patients and everyone agrees on is definitely better than having someone who's doing it behind closed doors.
I'd like to think that the patients, consumers would benefit first and foremost.
Also the staff, because actually improving communication is going to improve efficiency and going to improve their roles, because it's going to make it easier for them hopefully going forward, and also improved diagnoses, getting things right.
Whilst in the short term the health service and patients will benefit, I think longer term this will hopefully have a ripple effect against its competitors and the wider technology sector, and therefore the wider public.
I think finding out just what the sort of huge range of views there are about. You've got these principles that sound great in principle and everyone sort of agrees that these things are good, but what do they actually mean in practice?
I think being able to meet people from various backgrounds, as a clinician, you're very much sort of at the coalface. It's you and the patient. You don't really see people from policy backgrounds and health economic backgrounds.
The viewpoints of people here seem far less polarised than would be suggested by looking at the media and by our politicians and the views that they're taking.
To make it very clear that there is independent scrutiny about what they're doing.